Are we live now? Yeah, I think.
Hello, everyone. Good evening, everybody. I'm Priyanjali from Bladder Wellness team, and today I have with me renowned urologist from Lucknow, Dr. Shashikant Gupta. Dr. Shashikant Gupta, MS General Surgery, MCH Urology and Renal Transplant, is a urologist, uro-oncologist, and robotic surgeon currently practicing at Apollomedics Super-Speciality Hospital, Lucknow. He has rich experience in the field of urology, uro-oncology, renal transplant, and carries out various diagnoses and treatments with utmost precision and efficiency, ensuring that the patient health is in safe hands. Today, Dr. Shashikant will be discussing on a very important topic, which is role of robotic surgery in prostate cancer. Robotic surgery is a type of a minimally invasive surgery which makes use of minimalized surgical instruments guided by an advanced robot. It is a very advanced technique that allows the surgeon to perform surgical procedures in a very precise manner. Let's hear more on how robotic surgery is used in prostate cancer from Dr. Shashikant Gupta himself. Over to you, doctor. The first question for you would be, what is robotic surgery?
Yeah, thank you for your brief introduction. And it's for robotic surgery is a type of advanced surgery. And recently, we have seen many complex procedures are done by robotic surgery. So, robotic surgery is a type of precision surgery which is minimally invasive, and it has advantages of less blood loss, early recovery of patient, and good cancer control. And nowadays, we see more and more robots coming in Indian market also. And but robotic surgery is established in the West and USA very much. So now robotic surgery is coming and taking over the uh, open surgery and laparoscopic surgery uh, to a large scale. So, so robotic surgery, the people have misconception that robot is doing the surgery, and this is not
Mm,
so. In robotic surgery, there is an advanced robot, so which enhances the capability of a surgeon to do surgery with precision, with good vision, and with utmost intricacy during surgery. So it is like enhancing the capacity of a surgeon, and with the advantage of minimal invasive surgery, like surgery without any big scars and big incisions.
right. So, doctor, what was before this? Like robotic surgery, because of technology, has evolved so much. But
Yeah.
what was before this? How did doctors used to, treat the patients, and what was the treatment procedure before this? And how has this drastical change happened all of a sudden?
Yeah. So first of all, this is not a all of a sudden process. It's a gradually evolving process. First,
Hmm.
the surgeons used to do open surgeries. So in the last century, they are more focused on these open surgeries, various new procedures, new techniques developed to cure the patients and treat the cancers and other surgeries like renal transplant and other benign cases. So the open surgery is evolving since last 200 years, and then people came with the thought of that we should do the surgery from for inner parts of the body with some minimal invasive technique. So in open surgery, there is a risk of bleeding, more pain, and more larger scars and more larger incisions. So to overcome these problems, surgeons and the scientists, they invented the laparoscopic surgery. So laparoscopic surgery is a keyhole surgery. So we have to insert small tubes and ports inside your body, and with these small ports and holes, we insert some instruments which with the help of which we can do surgery with less blood loss and without a significant large incisions. This was a there was a time in 1980s that laparoscopic surgery evolved more and more, but the surgeons have a problem that in laparoscopic surgery it demands a lot of skills, and learning curve was more. And apart from this, the laparoscopic surgery has a less ergonomic maneuverability of instruments. Like you can compare it like if you are driving that automatic car with power steering, and you are driving a car with um 1980 model Maruti. So there is a lot of difference in driving and maneuverability. So that happens with the laparoscopic surgery also. So laparoscopic surgery was good, patient's recovery was good, but the problem is with that everyone could not be trained up to a maximum expertise level in laparoscopic surgery. So it has some limitations. So in parts of the body where uh, we can do it easily with open surgery, and we can do open surgery with more precision. But in laparoscopic surgery, there are some places in the body the surgeon could not reach with the instruments also, and it is more time taking process, more learning curve. To overcome these drawbacks of laparoscopic surgery, the surgeons and scientists, they invented the robots. So surgical robots are robots which uh, are the instruments they connect to the patients, and with the help of robotic precision and this robotic sensors, we have good visions. We can reach to the places where laparoscopic surgery is very difficult, and surgeons ergonomics is more comfortable. So that is the evolution of surgery from open surgery to robotic surgery. So
Right.
nowadays in Western countries and in rich countries and many of the European and countries and USA, the most surgeries are done by the robots.
Right. Right. So, doctor, what are the benefits of robotic surgery over other surgeries?
Okay, so let me tell about in brief that with robotic surgery, there is a clearer vision, more precision in surgery, good ergonomics to the surgeon, so he can overcome his fatigue. So ultimately, he has more concentration towards the disease removal and early recovery. That is a advantage of surgery. And in cancer cases, we see more cancer control with the robotic surgery as compared to laparoscopic or open surgeries.
Right. Well, moving ahead with the next question, doctor. How long does this surgery go on and how many incisions are there?
Yeah. So in robotic surgery, it depends on various procedures. So some procedures can be done in half an hour or 10 minutes or 15 minutes. And for some procedure, it may take 4 or 5 hours or 6 hours also. So the timing depends on the procedure complexity and where you are going to do surgery. And an important aspect is the surgeon's expertise. With experienced surgeons, if some surgeon is novice in robotic platform and he can he he's doing surgery in 6 hours, the experienced surgeon can do same surgery in 2 or 3 hours. So the surgeon's training and surgeon's experience is also very important in every surgery, be it open or laparoscopic or robotic surgery. So surgeon's experience is very important. And second
Right.
thing is there are various type of robots in the market. So uh, the most advanced and proven robot which has superior efficacy over other robots is Da Vinci robotic system. So definitely in Da Vinci robotic systems, so surgery can be done with more precision and much faster than other surgical robots. So at the present time, every country and some of the big companies are in the process of making more advanced robots. So various robots are in the market, but as far as surgical data wise and various procedure wise, Da Vinci surgical system is the most advanced and most precise system present in the market. So, and I have no conflict of interest in saying this thing that some robotic platforms are not so precise. So so people have to choose the best robotic platform in the market to get best results.
Right. Doctor, speaking about choosing the best, the best person or the best surgery or the best treatment, uh, cost is another thing which comes in between. Like patients are very much worried about the cost. What is the cost factor in this? How does it differ between both the surgeries?
Yeah, so as compared to open surgeries and laparoscopic surgery, robotic surgery are more costlier. Uh, but this is for the initial cost of surgery. But as you
Mm,
see, that recovery is faster, less blood loss, so complications are less. So
right.
so robotic surgeries are overcoming the cost issue very rapidly, because with the precision of robot and uh, by having robotic surgery, patients have very fast recovery. Even some procedures which have to be done with open surgery, patient have to be admitted in hospital for 5 to 6 days. But in uh, robotic surgeries, he can be discharged in 1 or 2 days. So that's why the hospital admission and cost, admission cost and hospital stay cost is reducing in robotic surgery. So as a net comparison, if you compare the long-term cost, so robotic surgery is equivalent to open or laparoscopic surgery.
Right.
Initial cost
So,
is more,
doctor,
but yeah.
yes, yes. So, doctor, do we suggest robotic surgery only when the case is too serious, like we are talking about prostate cancer here? So, is robotic surgery only suggested then, or previously also when we see a small enlargement, then also robotic surgery can be suggested?
Yeah, so there are various indications and indication for robotic surgery. Previously, mostly the complex cases are being done by the robotic surgery, but nowadays the distinction is coming closer. So for benign condition also, like a large prostate also, we can offer this simple robotic prostatectomy. So it is also coming and evolving rapidly. So, as the cost of the robotic surgery is coming down, so people are opting for this robotic surgery for more benign cases like hysterectomies, cholecystectomies, and hernias, and this simple prostatic enlargement. So, nowadays, the distinction for robotic surgery that only complex cases should be done with robotic surgery is fading.
Right. Doctor, so if you're specifically talking about prostate cancer here, how does it form initially, and how does it go to that cancerous stage? Is it because of the negligency of the patient, or are there any other factors behind it?
Yeah, so the prostate cancer, uh, if we go for the cause of the prostate cancer, so the cause may be genetic factors, some environmental factors, and mostly these factors are cannot be controlled by the patient. So, and
Hmm.
the initial symptoms of prostate cancer are also very minimal. So, uh, the best way to detect a prostate cancer screening, which has been done from last 50 years in America and European countries. And in India, there is no provision of screening of prostate cancer. So, best way to detect prostate cancer is screening, because initial symptoms are very minimal or less. It is like symptoms of enlargement of prostate and some blood in urine. These are the symptoms of prostate cancer.
Right. Doctor, moving ahead, also, there are a lot of people who are also wondering about the risks which are associated with robotic surgery. So, can you please elaborate about the risk which are associated with robotic surgery?
Yeah. There are various factors and various risks associated with any of the surgeries, but robotic
Hmm.
surgery is very safe. Uh, but you have to choose best robotic system, the experienced and trained surgeon, and your disease should be operable. These three factors are there. So, for any surgery, robotic platform cannot be used, and uh, if the robotic platform is not very good, so the result will not be up to the mark. And apart from that, if your surgeon is not experienced, then chances of complications are more. So it is proven fact, and there are various studies which shown that a surgeon who is a good robotic surgeon should have at least 100 cases experience. And most of these studies are done on the robotic surgical platform, as I mentioned earlier, is Da Vinci's surgical system. So the best system available in the market is Da Vinci surgical system, and an expert surgeon, if you choose an expert surgeon, so complications are less. So complications are like the same with the laparoscopic surgery, like bleeding, hemorrhage. If you are treating cancer by the robot, and there are chances of leaving the disease in the body, and sometimes functional outcomes are not uh, very good, uh, apart from surgery being done with the surgery. So, as I mentioned, that patient has to choose three factors. First, if he is choosing for robotic surgery, so the surgical platform should be good, the surgeon should be experienced, and his disease should be localized or operable. These three factors are there. So, uh, if these three factors matches, the complications are very less as compared to open surgery or laparoscopic surgery. And if these factors are not met, the complications are more.
Right. So, doctor, what about diabetic patients? We know that the healing rate is very much lesser than average human in a diabetic patient. So, what do we normally suggest them at today's date? A general surgery or a robotic surgery? Which option would be best for them?
Yeah. For diabetics patients and immunocompromised patients, so there is a definite advantage of minimal invasive surgery. So I advise that diabetic patients should choose these minimal invasive methods, either laparoscopic or robotic surgery. And for complex cases and for this urological malignancy, so there is no match of robotic surgery.
Right.
And
With that, doctor, yes, I can see some questions coming up from the viewers. The first question is been asked by Himanshu Verma, who asks, how accessible is robotic surgery to patients currently?
Yeah, so currently in I think, major cities in India like Delhi, Bombay, metro cities, and in type B cities like Lucknow, there are various places where he can find this robotic surgery. So the problem is with not with the robotic surgery system. The problem with the trained surgeon. So trained surgeons, so the robotic surgery is newer, and many doctors are not trained in robotic surgery. So that is the lacuna. Robotic surgeon, you will see in next 5 years there will be robotic surgical system in every city. The problem will be with trained surgeons. So, as I
Right,
mentioned earlier, if the surgeon is not experienced enough in robotic surgical system, he cannot give the best result. So, robotic surgery is available in every metro city and every B-grade town in India nowadays. And in
right,
future also, it is expanding very rapidly.
right. So, doctor, you are stressing on a trained surgeon and again in today's session.
Yes, yes.
We can definitely understand how important is it, but how do people choose that trained person? I mean, internet is not doing justice to that. There are a lot of doctors which we get to search. Normally, everything, all the informations are in our fingertips, and we blindly trust the internet at today's world. Also, we get to hear from a known person, or maybe a neighbor who has done it, or maybe a friend who has done it, and then they have got good results out of it, but not necessarily we would get the same result. So, how do one choose the perfect expert for them?
Yeah, so for that, he has to do some research on this internet. He should go through the CV of the doctor, how many robotic surgery and how many oncological or how many types of surgery he has done. Is he experienced surgeon in robotic surgery? He may be expert. A person, a doctor, may be expert in open surgery, maybe in laparoscopic surgery. For robotic surgery, he should have some experience in doing surgery. So people have to do some research, and he can choose the fellowship trained person or a person who is trained in robotic surgery in some good robotic centers. So some background research is a must for the patients also.
Right, right. Well, as we always say, please do not trust anybody blindly, anybody who is suggesting you
Yeah,
uh,
yeah.
for any expert, or
So for in
just because
today's
yes.
you cannot trust any one person. So you should always treat always go for the second opinion also. If somebody is providing you option of any surgery or any procedure or any medication, you can always choose the second opinion. So second opinion is very important, and if someone is giving opinion about surgery, robotic surgery, you should also take second opinion. There is no harm, and the things will get clearer. And
Absolutely, absolutely.
apart from this experienced surgeon, one thing also that I have mentioned, that you should not opt for any robotic surgical system. It should be proven, and the most proven surgical system right now is Da Vinci surgical system. So outcomes are depends on surgeon's experience and the surgical systems.
Well, very rightly said. So again, people are wise nowadays. They know what they are doing. They know how to take out the information. But there are also a certain mass of people um, who have no idea. They are just confused with things. They just need the right person around them, and that is the moment when everybody misleads the person. So
Yeah,
please, अपनी प्रॉब्लम अपनी समस्या का जांच खुद से करें। शायद आपको थोड़ा ज़्यादा समय लगेगा उसके लिए, पर मेक श्योर यू आर डूइंग द होमवर्क बिफोर ऑप्टिंग फॉर एनीथिंग। बिफोर यू आर ऑप्टिंग फॉर एन एक्सपर्ट, बिफोर यू आर ऑप्टिंग फॉर एन सर्जरी, मेक श्योर कि आप थोड़ा-सा जांच-पड़ताल कर रहे हैं, बिकॉज़ यहाँ बात हेल्थ की हो रही है, एंड यू कैन नॉट नेग्लेक्ट योर हेल्थ any day. Moving ahead with the next question, doctor, which comes from Vivek, who asks, what are the main benefits of robotic surgery for patients? I think doctor has already mentioned it, but again, do you want to
I can
talk
I
about
can
it a
again
little
mention
more,
it.
maybe?
Main advantages of robotic surgery is the clearer vision for the surgeon, so he can operate the complex tumor or complex surgeries with utmost precision. That is the main advantage for the surgeon. So he can give his best by the robotic surgical system. For patients, he will have the patient who is going to be operated with the robot. He will have less blood loss or minimal blood loss, and earlier recovery. So these are the two most important advantages. And with earlier recovery, he can join his work early. He can do his regular work very early. And apart from this, there is no large incision or scar in the body. So the robotic surgery, the main advantage also with the scars, because all the robotic surgery is done by the minimal incisions, like 10 incision is maximum incision in robotic surgery. So most of the instrument goes inside your body with 3 or 4 small 8 incisions. So all surgery, complex surgeries can be done with these 3 or 4 small incisions. So that is the most important advantages.
Right. The next question, doctor, comes from Akash, who asks, what kind of maintenance and calibration do robotic system require?
Yeah, okay. So the robotic system requires a lot of maintenance. So the the robotic these systems, they have deployed teams in each city which have these robotic systems for proper maintenance and the precision. So the surgery is very precise. This is a proven Da Vinci is a proven robot, and I think more than 1 million surgeries are uh, have been done with this surgical robotic system. So it is well proven, very precise, and for maintenance they have a backend team. So it is maintaining and apart from this, every robotic surgery it is being connected with the internet to the surgical robotic company. So they keep watch on each and every default and every error in the machine. So they can remotely correct these errors in robotic systems. So these are very foolproof systems. So and I think the chances of error are very less, and I think I have uh, I have been part of robotic surgeries more than 500, but I haven't seen any case of error that cannot be overcome during the surgery or after the surgery.
Right. Moving ahead with the next question. The next question comes from Rahul, who asks, how does recovery time compare between robotic and traditional surgery?
Yeah, as I said that in traditional surgery or open surgery, so there is a very large incision in the body, and there is a lot of blood loss in open surgeries. If uh, So, lot of difference between open surgery and robotic surgery. So, robotic surgery have a blood loss of minimal 1 or 2 units. I think more like 500 ml of blood loss in every open surgery. But in robotic surgery, the blood loss is like 30 to 50 ml in one surgery. So, there is no impact on patient's body, minimal impact, and apart from this, there is no large incision, only keyhole incisions. So the point is, if you are having minimal trauma in the normal body tissue, so you have enhanced recovery and quicker recovery and less damage to the body. So that is the theme of robotic surgery: less blood loss
Right.
and less injury to other organs.
Right. Right. The next question, doctor, comes from Bhavesh, who asks, so what is the patient selection criteria for robotic surgery?
Yes, it is also very important. So that I mentioned that expert surgeon can choose which patient to undergo an open surgery or laparoscopic or robotic surgery. So the selection criteria depends on various factors. But nowadays, I think there are very less indication for open surgery. Most of the surgery can be done with robotic surgery. So if we see that there is previous radiation in the body or multiple surgeries in the body, so that may be an indication for or some coagulopathy. So that may be an indication for open surgery. And in case of some patient who cannot undergo some anesthesia related procedure, so in those cases, the surgeon opt for these open surgeries. But indications are
Right.
very minimal, so in which robotic surgery cannot be done and open surgery can be done.
Right. The next question, doctor, comes from Harshit, who asks, can robotic surgery be performed on children?
Yes. So robotic surgery can be performed with in the children's also. So uh, for I think nowadays robotic surgery is very prominent in treating children's congenital disorders also. So many procedures like uretic implant, many urological procedures, because I'm mainly a uro-oncologist and urologist. So most of the childhood congenital anomalies can be treated with robotic surgery, like uretic implant, pyeloplasty, nephrectomies can be done with the robotic surgery very easily.
Right. Doctor, the next question comes from Rohan, who asks, can robotic surgery reduce the likelihood of infection?
Yes. So, as I said, that in open surgery, you have to cut open the body, and there is a large incision, so more chances of infection. So, definitely in laparoscopic and robotic surgery, there are less chances of infection also, because incision is less, so less chances of bacteria to penetrate into skin and incision site. So, infections are less.
Right. So, doctor, right after the surgery, how do we suggest our patients or advise our patients? Uh, what kind of lifestyle do we advise our patients? What kind of dietary habits do we suggest our patients right after the surgery?
Yeah, so right after surgery, it depends on person to person. If a person is not having any comorbidities or having less body mass index, so he can do the normal, uh, he can maintain his normal lifestyle, normal activity. And the advantage of this minimal invasive surgery is that he can do his work after 2 or 3 days of surgery very early. He can maintain his active lifestyle very early apart. So the dietary advice depends on person to person and disease wise. Diabetic, so patient is diabetic, so he has to maintain this low calorie diet or low sugar diet, and like hypertensive patients should opt for this less salty diet. So this depends on various medical factors. Okay. For surgery,
Right.
there is no after surgery there is no contraindication for any specific food or liquids.
So, what is the rate of reoccurrence of the cancer after being treated or after the surgery?
After the surgery. It depends on, it is a very vast topic. So the recurrence of cancer depends on the stage of the cancer. If the stage
Hmm.
is stage cancer is treated by surgically, I can talk about this prostate cancer. There are 4 stages of prostate cancer: stage one, two, three, and four. If the patient is
Hmm.
getting operated in the stage one or two, so his 5 year survival is around 95%. uh, but as the stage progresses, and stage three, if the person is getting surgery, so the survival is reduced to 50 to 60% in 5 years. In stage four, prostate cancer, we don't offer the robotic prostatectomy. So he has to maintain his lifestyle on some hormonal agents and androgen deprivation therapy. So the survival depends on stage, and recurrence also depends on the stage. If the
Right.
prostate cancer is organ confined or limited to prostate, so the survival chances are very good, and recurrence chances are very less.
Right. And what about hydration, doctor? We also know hydration is very much important. So, how much water to intake after the surgery? How much intake of water would be safe actually for the patients?
So water intake is very safe. There is no relation with robotic surgery and water intake. So patient can take whatever water he's taking before surgery. But in some cases, like in solitary kidneys, if you are doing some renal cancer and his creatinine is raised, so he has to follow the advice given by the nephrologist. So uh, it depends on the cancer or disease. uh, it is not generalized water intake recommendation after surgery.
Right, right. Doctor, what if the patient is already suffering from any sort of infection, per se, UTI? So, does the surgery gets a little complicated in that case?
Uh, so
or the recovery?
there are various type of UTI and other infections. So generally, in any kind of infection, we avoid uh, doing surgery rapidly. First, we have to treat the infection, then we can proceed for the surgery.
Hmm.
So first of
Hmm.
all, if some patient is getting operated in active infection, so there are chances of spread of infection. So we
Right.
may need the higher antibiotics and unnecessary antibiotic treatment after the surgery. And complications are also high if we operate on a patient who is having some active infection. So first we have to treat the infection, then we can proceed with surgery.
Right. Well, doctor, right after the surgery, but can any over-the-counter medications create any trigger for the patient? Like right after the surgery, if the patient is taking any over-the-counter medication, can it affect the patient and somehow?
Yeah, it can affect because over the counter that we don't know how it interacts with the body and other medications. So anyone who is getting operated should avoid these over the counter drugs and some Ayurvedic or
Hmm.
homeopathic formulations for a while.
Right. Well, these were few of the important topics which we have discussed regarding the topic, which is robotic surgery. We were in discussion with Dr. Shashikant Gupta today. Doctor, before we take a leave, any take-home message for our viewers who has watched us so far?
So I have a one only one message for viewers that uh, you should always go for active and healthy lifestyle. And if after all, if you are getting some disease, so you have to consult a doctor earlier, because if any disease, it can be diagnosed earlier, so it can be treated completely. So
Right, right,
I think regular health checkup is also very important. And if unfortunately you are diagnosed with some disease in regular health checkup, so you should get rid of this earlier. So don't
right,
neglect your symptoms, don't neglect your body, and uh, always try to have an active lifestyle and healthy lifestyle.
right, right. We, by the end of the day, we always focus on a healthy lifestyle and a good diet and a stress-free life. Well, these are the basic things of life, but somehow these are the most important things which we tend to forget with time. Don't do that, guys. This was the expert advice for today, and that was Dr. Shashikant Gupta for us. Thank you so much, Doctor, for your valuable time. It has been a very informative session for our viewers today, and we look forward to many more such sessions in coming time. Also, thank you, viewers, for your excellent participation. For more information, stay connected on our FB page, Bladder Wellness. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe
Thank
and stay healthy.
you. Yeah. Good night.